Hey everyone, and welcome back. Today we are looking at the source material behind a pretty incredible biological success story. We're tracking the journey of bringing a misfiring, completely exhausted nervous system back online. You know, if you've ever felt like your body is just running on empty, or maybe your cognitive focus feels suddenly clouded out of nowhere, we are going to break down the exact biological mechanisms of a specific treatment that is designed to get your internal wiring totally restored. Let's start with a scenario that, honestly, might sound super frustratingly familiar. Have you, or maybe someone you know, been experiencing unexplained weakness? Or what about sudden waves of confusion? Or even just a really weird numbness in your hands or feet? These are the kinds of symptoms that absolutely disrupt your daily life, but they can be kind of tricky to pin down, right? But what's really vital to understand here is that these aren't just random isolated things. They are very often your body's waves sounding a massive alarm. They actually point toward a very specific biological root cause, literally a deficiency that actively stops your nervous system from communicating the way it should. When we take a step back and group these warning signs together, a fascinating clinical picture really starts to emerge. First up, we've got the physical drain, so generalized weakness and remarkably pale skin. Then the neurological misfires kick in. We're talking tingling and numbness, which can literally feel like a bunch of pins and needles poking into your hands or feet. And honestly, perhaps the most concerning part is the cognitive impact, stuff like memory issues and sudden confusion. Looking at all this as one complete clinical picture, it becomes super clear that the body is struggling with a massive systemic deficiency. Think of it like a giant power outage happening right at the cellular level, basically short-circuiting everything from your blood all the way up to your brain. So when physicians see this specific constellation of symptoms, the catalyst to actually kickstart the journey to recovery is often a targeted pharmaceutical intervention. The source material highlights one called MECOZAM. The active ingredient in this is mecobalamin, and it's formulated to really strict JP specifications. It's manufactured by Zamko, a company that specifically notes its focus on quality and care. This medication is frequently used to essentially pull the body right out of that depleted, exhausted state. But you might be wondering, what makes this specific formulation work so incredibly well? Well, the magic number here is 500, as in a 500 microgram dosage per tablet. Now, to put that sheer amount into perspective, to get 500 micrograms of this nutrient naturally from food, you would have to eat roughly 1.5 pounds of beef liver. Or, if that's not your thing, you'd have to choke down over 800 eggs in a single sitting. Yeah, no way that's happening, right? Because of that, this dosage is specifically formulated for maximum potency and, crucially, bioavailability. Now, bioavailability just means how much of that massive dose actually makes it into your bloodstream where your body can actively put it to work. In the context of severe neurological symptoms, having a highly potent, bioavailable dose is exactly what the body demands to rapidly correct the deficiency and turn things around. Okay, let's just demystify the medical jargon for a quick second here. Whether you hear methacobalamin or methacobalamin, we are essentially just talking about vitamin B12. It is the absolute foundational fuel that your nervous system relies on for proper functioning. And here's the kicker. Your body cannot produce this on its own. It has to be ingested. So when your intake or your absorption drops, that's exactly when that whole cascade of negative warning signs begins. Understanding that this treatment provides a highly bioavailable form of vitamin B12 really helps us map out the exact journey of how this heals the body. So how does this sudden influx of B12 orchestrate a successful recovery? Well, it operates on a pretty brilliant three-step roadmap. First off, it helps the proper functioning of the brain and nervous system. This is what directly combats those memory issues and the confusion we talked about earlier. Second, it drives the production of RBCs, or red blood cells. Remember that symptom of weakness and pale skin? A lack of oxygen-carrying red blood cells causes exactly that, so this mechanism directly fixes the physical fatigue. And third, it regenerates the myelin sheath. Honestly, this third step is so fascinating and absolutely crucial that we really need to zoom in and look at it a bit closer. This brings us to what I consider the real climax of this biological success story, the myelin sheath. Just think of your nerves like a bunch of electrical wires. The myelin sheath is that protective, insulating coating wrapped tightly around those wires. A core biological action of this medication is to regenerate that exact sheath. Because when you lack vitamin B12, that insulation degrades. The wires literally get crossed or they short circuit, which is exactly what causes that weird physical sensation of tingling and numbness. By regenerating that protective coating, the body directly addresses and completely resolves the root cause of the numbness. It is just a fantastic example of highly targeted cellular repair. But beyond just the cellular repair, this intervention is completely designed around patient reality. It offers multiple neurological benefits, as we've just seen with the myelin sheath regeneration and the brain function support, but it also provides versatile administration options. Because let's face it, trying to overcome severe fatigue and intense brain fog really shouldn't require you to go through exhausting or overly complex treatments. The source material notes this is presented as a film-coated tablet, which makes it a really straightforward, highly potent, and totally accessible way for patients to get this essential biological support right into their system. Of course, getting the complete clinical picture means we absolutely have to look at how the body might temporarily react to this high-potency influx. Looking at the clinical notes, we can categorize these potential side effects into two main areas. Over on the general and neurological side, they include things like headache, fatigue, and skin rash. Then, on the gastrointestinal side, patients might experience diarrhea, nausea, anorexia, or abdominal pain. Having a solid, balanced understanding of a drug's complete profile is just a key part of navigating any medical journey, back to health for sure. There is also a really crucial, super reassuring detail to highlight regarding its safety profile. This formulation is marked as safe in pregnancy. For expecting mothers who might be dealing with severe fatigue, profound weakness, or scary neurological symptoms, finding safe interventions can be notoriously difficult. So this specific safety detail provides a ton of reassurance that this form of vitamin B12 can actually be utilized to protect both maternal and fetal health when these specific deficiencies pop up. Which naturally brings us to our final thought for today's explainer. We've just decoded how a tiny 500 microgram tablet of vitamin B12 can basically orchestrate this incredible journey of success, successfully regenerating nerve coatings, boosting red blood cells, and clearing away intense brain fog. It's such a powerful reminder of how deeply interconnected and incredibly nutrient-dependent our bodies truly are. So I'm going to leave you with this one question to think about. Is your nervous system getting the support it actually needs? Thank you so much for joining me to unpack this fascinating biology today. Keep asking those great questions, keep learning, and I'll see you in the next explainer.